and thank you for taking the time to come to this press briefing on a Friday evening. I'd like to start off by thanking all those involved who've been working 24/7 for the last 2 months on the response to the cholera epidemic in Haiti. We have been assessing all our responses, particularly with prevention and treatment strategies. And as we go along and new opportunities arise, it behooves us to look at those additional potential strategies that perhaps would help us save additional lives. And we learned that there may be additional cholera vaccine supply available. Early on in the outbreak, we were informed that there was very few doses, so it was really not a decision that we could take in order to have an extra tool in the toolkit in the response to cholera. We held this meeting, as Dan mentioned, calling upon the best experts in the world to provide the Ministry of Health Haiti and PAHO advice as to how to go forward. And in so doing, when we convened the meeting, I think there was a spirit that we all agreed to discuss the potential role of cholera vaccination, recognizing what we know, and perhaps most importantly, recognizing what we don't know, so we can begin to fill those information gaps. So I was very pleased with the outcome. I think there was some excellent recommendations going forward. This is a disease caused by a bacterium that has a foothold in Haiti and will be in Haiti causing endemic cholera for many years to come. So if we have opportunities to better our response, we really need to study those carefully, and that's indeed what we did. So with that, I'd like to ask Dr. Ciro de Quadros to comment, who was the chairperson of the meeting. Dr. de Quadros is also the chairperson of our technical advisory group for immunization and vaccines here at the Pan American Health Organization. And we were also honored to have Dr. Roger Glass, who's the director of the Fogarty Center at NIH, serving as rapporteur, who will also have some comments. So, Dr. de Quadros.
Thank you very much, John. It was really a great honor to chair this meeting, and I want to congratulate PAHO for the leadership on this issue in calling the best experts in the world to advise both the Pan American Health Organization as well as the government of Haiti, and actually all the governments that eventually could get the same kind of problem. We reviewed all the situation, the epidemiological situation in both Haiti and Dominican Republic. We looked at the vaccines that are now available, and we looked at all the issues related to what could be done under the present circumstances in Haiti. The first thing that came to light is that there are not enough vaccines available in the world today. It's less than 300,000 doses of vaccines that are available in the next 3 or 4 months, with the potential for more vaccine towards the end of next year. So this is a limitation that exists at the moment for the use of vaccine anywhere in the world, actually. There are only 2 producers of this vaccine. One of them is not pre-qualified by WHO, so that the United Nations systems cannot purchase that vaccine from that laboratory. So the situation is not really the ideal to face the epidemic. So what this group recommended the organization is that they see the present stock of vaccine that is available in the world. And mind you, cholera is not available only in Haiti. It's available in several other countries of the world which also needed the vaccine. So you have to be very careful when planning that, because you cannot take the clothes from one person to give it to the other person. So this is a very important ethical problem. So, but anyway, the recommendation was that the PAHO dialogue with the suppliers, see which kind of availability they could have starting next year in a monthly basis, so meaning how many doses they could produce by month. That PAHO dialogue with with organizations that could finance the purchase of the vaccine so that you could then have guarantee to the suppliers that the vaccine would be purchased if it's available, and with that then it could start a demonstration project in Haiti sometimes in March or April next year with a continuation throughout the year if the vaccine would be available and would be financed. So with that is basically the bottom line of the recommendations of this group, and of course that there will be a tremendous need, you know, for all the look of all the organization of such vaccinations in Haiti under the present circumstances, all the logistics, the supplies, the personnel, the communications issues, and so on. So this is basically the bottom line of the recommendations of the group today. Roger?
Yeah. Yeah. Thank you very much, Ciro and John. First, I think it's been wonderful, John, and I have to congratulate you for having PAHO lead and organize this session today. It's clearly most timely, and it addresses a very critical question. You know, cholera is and remains the most severe and rapidly fatal of the diarrheal diseases, and as we've seen in Haiti, there are over 2,000 deaths already, tens if not hundreds of thousands of cases, so it's an ongoing problem. We now have a new tool in our armamentarium to deal with this, which is the vaccine, and that's to be added to provision of treatment with rehydration solutions and with clean water and sanitation. So the challenge for us in reactive vaccination is how best to use vaccines in this type of challenging setting to prevent the loss of life. I think we have precious little experience in how to do that, so there is a research agenda before us to see if we can make this effective and if we can demonstrate the efficacy. There are lots of logistic challenges. There are challenges in the use of the vaccine because we know that these vaccines provide herd protection and they have certain other advantages. So the challenge before us is in the short term to take the vaccine that we have and see what we can learn in using it most effectively, and in the long term making sure that we have adequate supplies of vaccines to address in a reactive form the outbreaks that occur in Haiti and in the Americas and around the world. Right now we're in the middle of an outbreak. We don't know where it's going and we don't know when it will end, but it is likely to persist for some time. And for that reason, we have to think both short-term and long-term about the possible use of vaccines along with the other interventions. But vaccines are the newest addition to this armamentarium. Thank you.
Yeah, and before John makes another comment, just to stress this fact, you know, there is a major lesson from this situation is that we don't have enough vaccine. So it's important for the future that we have a stockpile of vaccine to face similar situations that certainly will occur in the future.
Thank you, Cyril. I just want to take a moment to recognize the presence of two people who will be very important in terms of the going forward with the work. Dr. Guatemoc Ruiz Matos is the director of our vaccine program who coordinates the team there that works on these issues, and Dr. Andrea Vicari in the back is the focal point for the cholera vaccine, who will certainly be pushing this forward with the support from others on the team and our partners. We should recognize our partners. Roger, I appreciate all the support you've given, as well as the Sabin Vaccine Institute and other partners in town that came and attended the meeting. We had AID, we had Doctors Without Borders, we had a couple of NGOs, we had the Gates Foundation, we had the National Vaccine Program, we had CDC, Health and Human Resources, and others that I'm forgetting. But again, appreciate all the support and the teamwork and spirit of core that went into the meeting that happened.
Okay, thanks, Dr. Andrews, Dr. Reguadros, and Dr. Glass. We want to open up to questions. Please go ahead, please.
Hi, I'm Luis Alonso with the AP. If I understood well, you just said that the available stock is 300,000 vaccines now. I would like to know how many vaccines are necessary, what's the ideal goal, how much would that cost, that ideal stock, and who will be paying for them? Thank you.
Yeah, that's the $6 million questions of who will pay for that. But we had the feeling in the room that once a strategy is worked out, and once the suppliers can guarantee that they can provide additional doses by month, that then the financing would be available. At present, there is only 100,000 doses available at this moment in the world, which means 100,000 doses that are labeled. And this is only for vaccinating 50,000 people, because you need 2 doses. Now, besides that, there is also a stock of 1 million doses that are not packaged and labeled. And this will take also some few months to get on the way. So that's the present situation of the stock of vaccine in the world today. But if there would be a guarantee in the demand, then both suppliers could produce maybe 2 to 3 million doses of vaccine per year. But this you need, a firm commitment for the demand. And that's why the importance of this stockpile, which then can guarantee for the suppliers to produce the vaccine. Now, for the amount of vaccines needed for Haiti or for Dominican Republic, this we don't have the figure, because now there will be the potential for this demonstration project that then will be expanded as vaccines become available. So that's not yet worked out, and will be worked out as the different groups under the leadership of PAHO and the Ministry of Health of Haiti and other partners in Haiti then will work out how you start the demonstration project.
But there's not even an approximate number? There is not even an approximate number of how many vaccines are needed for the island?
At this moment, we don't have a number.
Okay. We have a question from Eric Turco from MINUSTA, who says, we were advised by Dr. Andrus not use the vaccine while the outbreak was ongoing. Now we want to know if that position has changed.
We, at a time when we were told there was no vaccine or very small numbers of doses of vaccine available, that it was more important to stay focused on saving lives and preventing the spread of transmission. That was the basic message. Now, we also received questions, should we vaccinate health workers or other service people? And the recommendation was no. And that, I would say, regardless of the supply, because hand washing, a physician or nurse caring for a patient who uses good hygiene and hand washes between the care of patients, I know of no evidence to suggest that a healthcare worker, like you see in a measles situation, of amplifying transmission. So that was the basis of that recommendation. And thank you for your question. It was a great question.
Okay, and then we have another question from Reme Indeku, who says that when we had the outbreak of influenza A H1N1, we manufactured and distributed in record time enough vaccine for the massive needs of all the countries. How is it that we are so short of vaccines for Haiti for a disease which we know, and we know that the vaccine already exists? Why will it take so long to increase the supply of vaccines available for cholera?
All right, so one response to that is that Haiti has not had cholera for 100 years. So I think this has not been on the agenda. I must say that there have been recommendations for use of cholera vaccines by the World Health Organization since 2005. But it hasn't received the same recognition that the vaccines for instance, flu has received, in part because flu perhaps has gone globally rapidly, whereas cholera stayed in several focal points of the world where they're just more poor populations and more difficult situations.
I think that your last statement is important to recognize, where flu vaccine is a global strategy, and there's a market for it, where with many diseases of poverty, there is not that same market force driving supply.
Thanks, Dr. Glass and Dr. Andrews. Dr. De Quadros, we have a question for you from Richard Knox, the science correspondent of National Public Radio. It says, when you say there are 1 million doses available in bulk, is that between the two manufacturers? How much for each manufacturer? And the second part is there a prospect of getting WHO pre-qualification for the Shanchal vaccine in the next few months? And how much vaccine would that make available?
Yeah, the 1 million doses that are not labeled, it's from one of the suppliers. So it's just from one supplier. And the pre-qualification from the Shanta laboratory is expected to be sometime in the first quarter or second quarter of next year. You know, Shanta had a problem with one of their vaccines, the pentavalent vaccine, which was withdrawn from the market because of problems in the quality. And but WHO was acted very well in this sense, because usually when this happens, they would interrupt the whole process. But they did not interrupt the process of pre-qualification for this vaccine, and is expected either in the end of first quarter or second quarter to be pre-qualified.
Okay, thanks. Are there any other questions from the room? If not, then thank you very much.